Hello and welcome to this edition of Doc Talks. I'm Dr. Don Selby, a naturopathic physician. Today we're going to talk a little bit about thyroid hormones and thyroid treatment. So a disclaimer for us here is that don't take the information that we give you here today to do your own diagnosis or treatment. It should not take the place of the advice of a qualified provider. If you have questions and you want to call me, please do so. We'd be happy to hear from you. So for thyroid hormone evaluation and treatment, let's start with an explanation of the thyroid gland. It is the master controller of the body's metabolic processes. If you have low thyroid activity, it is deemed hypothyroidism. These people are likely to be sluggish, fatigued, cold, even dull. The most common form is Hashimoto's thyroiditis. It is an autoimmune disorder in which antibodies from your immune system are attacking some of the enzymes used to produce the thyroid hormone. High thyroid is hyperthyroidism. It is much less common. These people are likely to be hot, hyperactive, have dry skin, brittle hair. The most common form is Graves' disease. Anatomically, we're going to find the thyroid gland shaped a little bit like a butterfly on the front of the neck at the trachea and just above the clavicle or the collarbone. If you put your fingers on the clavicle and then on the trachea, you're going to find your thyroid gland right in that area. When it is evaluated by a trained medical professional, we can actually appreciate the edges of it when a patient is swallowing and tell us whether that is enlarged. We want it to be smooth. We don't want to find nodules. We don't want to find bumps and lumps on it, but it does have to be evaluated carefully. This gland produces thyroid hormone because of a signal from the brain. The signal comes from the pituitary gland. It's actually a hormone called thyroid stimulating hormone. When the TSH value is high, it means the body does not have enough thyroid hormone. When the TSH value is low, it means the body either has enough, it's euthyroid, or sometimes it has too much thyroid hormone, and in that case, the person is going to be hyperthyroid. This is a little bit like a doorbell. If somebody comes to the door and they ring the doorbell, if you don't answer it quickly, they're probably going to ring the doorbell again and again and again. That's what the thyroid stimulating hormone does. If we don't have enough thyroid hormone, it's going to keep sending that signal to the thyroid gland, make more thyroid hormone. The thyroid hormone is actually a large, complicated molecule, and it's made in stages. In step 1, an iodine molecule is biochemically added to an amino acid that is called tyrosine. And we call this monoiodotyrosine. Now in my slide here, I've got this as if it's 3 words. It's not, it's 1 word. I just wanted you to be able to pronounce it. 2 of these monoiodotyrosine molecules are then combined to form diiodothyronine. We've got a little bit of a name change here. And then finally 2 of the diiodothyronine molecules are combined to form tetraiodothyronine. And we don't want to keep saying tetraiodothyronine, so we usually just call it T4. When the body lacks adequate T4, so the brain's going to send that signal, TSH, to make more of the thyroid hormone. Now, to make this a little bit more complicated, as if we needed to, the body doesn't actually use T4, it uses triiodothyronine, T3. To get T3 from T4, one part of that T4 molecule needs to be disassembled. But wait, let's make this even more complicated. The iodine molecule must be removed from a specific part of the T4 molecule. If the wrong part is removed, it's deiodinated, it simply won't work. And the TSH level goes back to signal that we need to make more T4. I tell you this to say this. Whenever a body process is this complicated, it is far more likely that something is going to go wrong. Therefore, if you have a thyroid issue, hypothyroidism is the more common, you are in very good company. You are definitely not alone. So let's kind of review some of the causes of hypothyroidism and some of the symptoms of hypothyroidism, and then we'll contrast that to hyperthyroidism. So the main causes of hypothyroidism, as we've already mentioned, is Hashimoto's thyroiditis. It's an autoimmune disorder. Again, antibodies are attacking the enzymes necessary to put that complicated molecule together. Hypothyroidism can also result from a surgery to remove some or all of the thyroid gland, a thyroidectomy, because of nodules or some other concerning growth in the thyroid gland. If there is radiation therapy, that will almost always induce a hypothyroidism. And then there are some medications, I've only listed lithium here, but there are certain medications that will induce hypothyroidism. Symptoms of hypothyroidism include gaining weight. You couldn't lose weight if you wanted to. I don't care how good your diet is. You're going to find a puffy face, fatigue. You're going to be very sensitive to cold. These patients may have depression. They may have memory issues. They are likely to have coarse, thick hair, and ladies that are still cycling will have heavy, prolonged menstrual cycles. That's hypothyroidism. Let's contrast that with hyperthyroidism. The most common cause is Graves' disease and autoimmune disorder. A third world country type of issue is the toxic multinodular goiter. That basically is a lack of iodine. We don't lack iodine. We have iodinated salt that is way too common in this country. Unless you're getting sea salt, you're probably going to have plenty of iodine in your diet. There is a toxic growth, the toxic adenoma, that can cause hyperthyroidism. And then one that's kind of fun is, in a bad way, is factious thyroiditis. Now, in this case, somebody is taking medication for low thyroid, and what's happening is that they are losing weight, and they recognize that as a weight loss drug, and they overuse or abuse the thyroid medication, and it damages the thyroid, and that's factious thyroiditis. So, symptoms of hyperthyroidism will be the unintentional weight loss because you're hyper, you're really active. Maybe heart palpitations, tremors, handwriting is really bad, heat intolerance, increased anxiety and irritability. These people are likely to be fatigued but have muscle weakness that goes with it. Increased frequency of bowel movements, maybe even to the point of diarrhea, hair loss, loss of libido. Women who are cycling may stop cycling, that's amenorrhea, or have just a very uncommon or irregular cycle, the oligomenorrhea. So how do we evaluate this? Well, we start with history and physical. What signs and symptoms have you been exploring? How long has this been going on? We take your vitals. We're actually going to do a thyroid palpation. We want to be able to see if we can discern whether there are nodules on the thyroid. Is it enlarged? Of course, there will be laboratory testing. A complete metabolic panel is common. We're going to test for the thyroid hormones, the TSH, free and total T3 and T4. And if we have any reason to believe that there is an autoimmune component of this, then we'll do the antibody testing, anti-TPO, and some of the others that will help us to get a better picture of this. If the patient is hypothyroid, we're going to treat it a couple of different ways. So way back in the 1890s, I think it was 1891, a physician identified what's called a natural desiccated thyroid as a treatment. This was from a pig. It was basically dried pig hormone. It's a mixture of T3 and T4. Bad news on this one is a couple of things. One, it requires multiple doses per day, and a lot of people don't want to do that. It's more difficult than a synthetic. Number two is that there is a lack of consistency with how much T3 and T4 is found in the natural desiccated thyroid. The synthetic thyroid hormones came out in the late 60s, early 70s. The most common is levothyroxine or Synthroid. It is a T4. Now remember, we told you we don't use T4, we use T3. Some people don't have the ability to deiodinate correctly, and so they are resistant to T4 therapy. In that case, we can add T3, which is liothyronine or cytomel, and it's usually going to be a combination of synthroid and liothyronine. If somebody is hyperthyroid, there are three common treatments that can be used. One is medication. Bad news is it's usually only temporary for a year or two. Methimazole and polypropyl, I think I just mispronounced that, propylthiouracil, thank you. And then can do a thyroidectomy to remove some or all of the thyroid gland. And then radioactive iodine ablation, and that is by far and away the most common treatment in the U.S. I hope you have found some of this to be useful for you if you are considering treatment for thyroid issues. If you think a more holistic natural approach is going to be best for you, come see me, give me a call. We'd be happy to see you. I'm Dr. Don Selvey at Copper Valley Medical.